Welcome to the Dave Palma Show, the podcast that revives, restores, and awakens your innermost capabilities.
You have the training and the talent to succeed, but do you have the guts to fail?
I love what I do. When you love what you do, you want to be the best at it.
Today is about the power of you. You will change the world.
Find your path to success through the journey of those who have succeeded. And now, your host, Dave Palma.
There's something people really stop to think about when they see a fire engine go past. The uniform, the sirens, the urgency. But not what comes after. Not what sits in the body of someone who's just walked out of a burning building. Not what lingers in their lungs, or their joints, or their sleep, or their mind months and years later. We tend to see firefighting as an emergency job. What we don't always see is that it's also a long-term health risk profession. And today, that reality is being formally acknowledged at government level in a way it hasn't been before. Well, I say today, I mean in recent agreement between the Fire Brigade Union and also the government. Basically, a new national approach has been announced. A Firefighters Concordat on Health and Wellbeing, backed by the government and shaped with fire services, unions and health bodies, as I've said. The stated aim is simple on paper: prevention, early diagnosis and long-term health support for firefighters during service and after they leave. But underneath those words is something much bigger. A shift in how we treat risk, responsibility, and care for people who spend their working lives running towards danger. So what's been announced? Well, this announcement comes from the Department of Health and Social Care and the Ministry of Housing, Community and Local Government, alongside senior political leadership including Wes Streeting and Samantha Dixon, MBE. At its centre is the creation of a national agreement, the Firefighters Concordat on Health and Wellbeing. It brings together government, fire services, unions and health partners under one framework. And it focuses on a few key commitments. First, consistent health checks for every firefighter in the UK. Not optional, not regional, not dependent on service budgets. And second, the new funding for research into firefighter health risks delivered through the National Institute for Health and Care Research. Third, a stronger on long-term issues like, or a stronger focus on long-term issues like cardiovascular disease, musculoskeletal injuries, mental health impacts, and cancer risks linked to the exposure. And fourth, something that often gets overlooked in emergency services policy: access to NHS care. That's the National Health Service in the UK, for those that aren't familiar with the UK setting, the healthcare setting, that actually fits the realities of shift work and operational life. It also includes a recognition that firefighter occupation will be better recorded in NHS systems so clinicians can understand occupational risks earlier in treatment. On paper, this is about structure, but in reality, it's about something more than basic. Whether the system understands people inside it. So what's actually being acknowledged here? There's an important line in the background of this announcement. For all the operational improvements over the years, better breathing apparatus, better decontamination, better PPE, There is still limited UK evidence on long-term firefighter health outcomes. That gap matters because without evidence, systems drift into assumption, and assumption becomes delay, or very often becomes delay. Delay in recognising occupational illness, delay in prevention, delay in support. Well, the government is now explicitly saying that firefighters face hazards that may not show their full impact for years. That includes exposure to toxic substances, repeated physical strain, traumatic incidences, and psychological load that builds over time rather than in a single event. So, what this Concordat is trying to do is move the system away from reacting after harm has actually taken hold, and towards spotting it earlier or preventing it altogether. So what's the real-term impact or real-life impact? What's this mean on the ground? Well, to understand what this actually changes, you have to step away from policy language for a moment. Think about firefighter in a typical UK station. A shift might include multiple call-outs to road traffic collisions, breathing in smoke and contaminants despite protection, physically carrying people in unpredictable environments, repeated exposure to trauma, disrupted sleep patterns across nights and days. Then imagine that over 10, 15, 20 years. The wear doesn't arrive all at once. It accumulates quietly. Muscle and joint issues, cardiovascular strain, anxiety that doesn't switch off after the pager stops, or after you go home if it's a firefighter on call on a fire station. And in some cases, illnesses that appear long after operational services has ended. The intent behind this Concordat is to catch those patterns earlier, to identify risk before it becomes diagnosis, to give firefighters access to consistent screening rather than waiting for symptoms to present, and to treat occupational exposure as something measurable, not invisible. So what's the systems behind it? This is not just a health policy. It sits across multiple systems that have historically worked in parallel rather than together. On one side, you have the NHS. On another, Fire and Rescue Service. On another, government departments. And then you have professional bodies like the National Fire Chiefs Council and the Fire Brigades Union, both of which have long argued for stronger health protections. What this Concordat is trying to do is align those systems around a shared expectation, not just treatment, but prevention, not just response, but long-time monitoring. It also sits within wider government commitments on workforce health, NHS access, and emergency service reform. So it is part of health policy, part workforce policy, and part public safety infrastructure. Because if firefighters are healthier for longer, services are more resilient. This is part of the argument being made. But there's a deeper layer too, which is responsibility. So what's the fire service reality, the frontline perspective? Well, there's a phrase that gets used in emergency services a lot. You accept the risk when you join. And in one sense, that is true. Firefighters who know the job involves danger. But what is often less discussed is how that risk is managed over time. not just in the moment of an incident, but across a career and beyond it. The reality is that many firefighters would experience repeated exposure to hazardous environments, long-term physical strain, cumulative psychological impact, and potential health conditions that appear years after or years later. So what's changing here is the idea that responsibility for that should not sit solely with the individual. Instead, it becomes shared across systems that employs, trains, protects, and monitors them. This is a subtle but important shift because it moves the conversation from what did the individual experience to what did the system expose them to over time. So what's the mental health and the less visible load? One of the clearest areas highlighted in this announcement is mental well-being. Firefighters don't just deal with physical danger. They deal with human situations most people only ever see at a distance. Fatalities, serious injuries, family trauma, sudden loss, and repeated exposure to distressing scenes. The psychological impact of that doesn't always show up immediately. Sometimes it builds slowly. Sometimes it appears after leaving the service. The Concordat aims to integrate mental health support more consistently, including better access to NHS services and clearer pathways to support that fits shift patterns and operational life. This is also where early intervention becomes critical, because once someone leaves the service, access often becomes less structured, and continuity of care can break down. So what's the wider contents or context? Why now? It's worth asking why this is happening now. Part of it is evidence. Part of it is pressure from within the fire service itself. And part of it is broader public sector reform around workforce health. And part of it is political recognition that emergency service wellbeing has often been reactive rather than preventative. There is also growing awareness of occupational illness across multiple sectors, not just firefighting. But firefighting is unique in one respect. The combination of physical danger, chemical exposure, and psychological stress is constant and repeated, not occasional, not the risk profile. So the risk profile is different. And the argument being made is that the support system should reflect that difference. So what's the government saying? Well, the framing from West Streeting is clear. Firefighters run towards danger, but the system has not always understood the long-term cost of that work. The emphasis is on prevention, research and partnership. From Samantha Dixon, MBE, the focus is on responsibility and long-term commitment, not just during service, but beyond it. And from the fire service leadership side, the message is consistent. Better evidence, better monitoring, better consistency across services, and better protection for those doing the job. What this could change over time. If this works as intended, the changes won't all be immediate, but over time it could mean earlier detection of occupational illness, more consistent health standards across UK fire services, improved mental health support pathways, better understanding of long-term exposure risks, and more structured NHS engagement with firefighter health data. It could also shift how future equipment, training and decontamination practices are designed, based on stronger evidence rather than assumptions. But that depends on implementation, because frameworks only matter if they are delivered consistently. So here's a closing reflection. At the centre of this announcement is a simple idea: that people who spend their working lives protecting others should not be left without structured protection for themselves. That sounds obvious, but historically, it hasn't always been fully embedded in how systems operate. Firefighters are often seen through moments of crisis. What this Concordat is trying to do is extend that view across an entire career. And beyond it, not just how they respond in the moment, but how they live afterwards, how they're monitored, how they're supported, and how early signs of harm are recognised before they become long-term conditions. There is still a long way to go in understanding the full impact of firefighting on health. This is part of what this agreement is openly acknowledging. But it is also a recognition that waiting for complete certainty is not always an option when people are already in the system, already exposed, already carrying the effects of the work. So this becomes less about single policy announcement and more about a direction of travel towards prevention, towards consistency, and towards a system that understands risk not just in the moment it happens, but in the years that follows. And that is probably the quiet significance of this. Not just that something has been announced, but that something long-term, previously undermeasured, is now being treated as a central part of how we support the people who run towards danger when everyone else is running away.
That's all for this episode. Thanks for listening, and remember, if you want to support what we do, then share, subscribe and leave a review over on Apple Podcasts, or head over to my website davepalmer.com and click on Rate Show. Well, that's all for now, but I'll see you in the next episode of The Dave Palmer Show.
Follow us on Facebook, Twitter and Instagram.